Dr. Nathan Wayne. Today I'm going to be talking about osteoarthritis of the knee guidelines that were established by the American College of Rheumatology. Now, the American College of Rheumatology is a national organization that I belong to. They established a panel that really set up these guidelines at the 2009 national meeting. And they did this for osteoarthritis affecting multiple areas. And their guidelines were graded as follows: provide strong evidence, we recommend; weak evidence, we suggest; and then no evidence, we do not use. And so those were the recommendations for all these treatments. And the panel established the guidelines by reviewing many drug and non-drug treatments that have been used to treat osteoarthritis in multiple areas. And here's what they recommended for osteoarthritis of the knees. For symptomatic knee osteoarthritis uncomplicated by comorbidities, meaning other medical conditions, and I certainly think that's rare because most of my patients do have other medical conditions, the panel strongly recommended aerobic land-based exercise, resistance land-based exercise, aquatic exercises, and weight loss if indicated. They did not recommend balance exercises, which I found to be very surprising. They did not recommend Tai Chi, lateral wedged insoles for knee osteoarthritis, manual therapy alone, bracing in combination with medical management, or lateral directed patellar taping of the kneecap. They had no strong recommendations for drug modalities for knee osteoarthritis, and only weak recommendations for acetaminophen, meaning Tylenol, topical nonsteroidal anti-inflammatory drugs for patients 75 years or older, oral nonsteroidal drugs for those younger than 75 years, tramadol, and steroid or hyaluronate injections. They felt that there was no good evidence to support the use of chondroitin sulfate, glucosamine, or topical capsaicin. Again, something that I found very, very surprising. For symptomatic knee osteoarthritis with a suboptimal response to full-dose acetaminophen, the panel strongly recommended topical nonsteroidal anti-inflammatory drugs for patients 75 years or older, oral nonsteroidal anti-inflammatory drugs for patients younger than 75 years, or intra-articular steroid injections as well. Tramadol, opioids, and intra-articular hyaluronic acid injections have weak evidence and were suggested by the panel but not strongly recommended. Again, somewhat surprising. Chondroitin sulfate, glucosamine, and topical capsaicin were not recommended. So what do I think? Well, I don't think much of this. I think we have a long way to go because these guidelines haven't changed in 50 years. And as rheumatologists, we've got to do a better job for our patients. And I certainly don't agree with these guidelines at all. But anyway, stay tuned. Thanks for watching. This is Dr. Nathan Wayne.